Can eye bag surgery have less downtime than filler injection?
Men and women with puffy under-eye bags that make them appear tired and older than their actual age might hesitate to opt for the definitive treatment, which is lower eyelid surgery, also known as lower eyelid blepharoplasty. Given that puffy under-eye bags are often hereditary and can manifest in younger people, lower eyelid blepharoplasty is frequently the first surgical procedure they ever have or consider for their tired-looking eyes. Since puffy under-eye bags frequently coexist with bone deficiency or under-eye hollowing, some milder cases of eye bags can be effectively camouflaged with an injectable filler, which is an option many people take so they can delay surgery. Much of the time, the camouflage is limited, and you still look tired with bags under your eyes. Since I perform both under-eye filler for hollow eyes as well as cosmetic eyelid surgery, I can speak to the reasons that people are hesitant about having the more appropriate and long-lasting benefits of lower eyelid blepharoplasty. In fact, from the beginning of my career over 25 years ago, I developed ways to help people of all ages with under-eye bags look better with minimal risk, with comfort, and with quicker recovery than conventional plastic surgery. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. As an oculoplastic surgeon with practice focus and specialized training in facial cosmetic surgery, I routinely perform a wide range of cosmetic eyelid procedures, such as correcting drooping eyelids or eyelid ptosis surgery, upper eyelid blepharoplasty to treat hooded eyelids, double eyelid surgery to create an eyelid crease for people born without one, and lower eyelid surgery to address puffy under-eye bags. I also perform revision surgery for patients who had eyelid surgery originally performed by other doctors in order to address complications such as lower eyelid retraction and ectropion, where the eyelid is pulled downward and displaced outward. As I mentioned earlier, I do a lot of non-surgical procedures to improve the appearance under the eyes, such as fillers, lasers, platelet-rich plasma, and platelet-rich fiber matrix every day in my practice. Given the perceived significance of surgery, many people are hesitant and instead choose non-surgical filler treatments to try to blend the under-eye bags with the adjacent bone structure. So what motivates this avoidance of having surgery? Well, frankly, the word surgery is associated with cold institutional facilities where you go under general anesthesia. Surgery around the eyes for people who are hesitant also raises fears of extensive bruising, pain, and even possible eye damage. There is also a fear of having to take extended time away from work and your normal life. Since I did a residency in eye surgery or ophthalmology before specializing in cosmetic eyelid surgery, I was experienced and very comfortable with local anesthesia since I performed very delicate surgery on and inside the actual eye without putting patients under general anesthesia. I also recognized how people undergoing cosmetic procedures are very uncomfortable in a cold, hospital-style operating room environment particularly with staff who may be caring but are not dedicated to only one surgeon and the procedural preferences of that surgeon. So I built hospital-level facilities in my offices and have dedicated staff who work with me every day. They know my patients, and my patients appreciate being cared for by medical staff they know since they met them during consultation and they see them at surgery and follow-up visits. Logistically, I can attest to how much better it is for me as the surgeon to have everything in my facilities customized to my preference so I can focus on the art of what I do without any concern about having things the way I like. I perform lower eyelid blepharoplasty from the inside of the eyelid. This technique is called transconjunctival blepharoplasty. Conventionally, eyelid surgery is performed from the outside of the eyelids through an incision that's made below the eyelashes. Unfortunately, this external approach does come with greater risk for bruising and can change the eye shape, such as rounding or scleral show. This approach I use is technically advanced and allows me to preserve the unique characteristic shape of your eyes. As far as risks for bruising, my patients typically return to work in 1 week with minimal to no bruising and minimal swelling. It's important to be aware that injectable fillers, while non-surgical, involve penetration of the skin barrier using needles, which oftentimes results in extensive bruising lasting 1 to 2 weeks or even longer. Patients who've had filler elsewhere prior to coming in to have surgery have often commented that they had barely any bruising with my surgery compared to having to deal with bruising every time they had filler injection. One of the greatest concerns for people about having surgery is the risk of injury to the eye or even blindness. Before addressing this concern, it should be stated that filler treatment does carry risk for eye and vision complications. While it is thankfully exceedingly rare, under-eye filler treatment carries a risk of vascular occlusion, where filler material is injected inadvertently into an artery, causing a blockage that can result in blindness. This type of event needs to be managed within a precious few minutes by a specialist like myself for there to be any chance of recovering vision. As far as surgery is concerned, the informed consent will list multiple possible complications. However, in medicine, as in life, we want to minimize risk, otherwise we'd never get into an airplane or could cross the street. As I mentioned earlier, I have extensive experience performing revision surgery for patients who have had complications from eyelid surgery who come to see me from around the world. My patients appreciate having someone like me perform their surgery, as the risk is significantly reduced of having complications by my level of expertise and experience performing eyelid surgery. No surgeon is above having a complication, but the likelihood decreases for the reasons I've already stated. Additionally, I should mention that I routinely help improve the appearance of fine lines and wrinkles as well as dark circles under the eyes when I perform surgery for under eye bags. I improve skin quality and tighten lower eyelid skin with collagen induction therapy like lasers and radiofrequency. I also use platelet-rich plasma, or PRP, or platelet-rich fibrin, or PRF, to also stimulate collagen production and new blood vessel formation. If you have puffy under eyes and fillers are just not as effective as they once were, I encourage you to consider lower eyelid surgery for the long-term benefit of more definitively treating the underlying problem. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.